I'd like to say that we can contribute a lot, and we're often put in the back room to talk quietly to people, and we need to be more at the table. Quite frankly, we are, it's. And I'm not talking about Newcrest specifically, but I know that a lot of people in their nursing roles are in a clinic somewhere, and they're reacting to if there is a crisis situation. We're not just crisis situation people; we're actually more in the prevention space, and so we need to be at the table. Is what I'm trying to allude to there. Is make sure that if you've got a nurse on site, that they're involved with the planning. Make sure, so the nurse role kind of sits, we kind of sit, we should sit in the middle really, between health and safety and HR, because, we kind of sit on the peripheral of both of those functions within business. And if one of those parts of the function don't really understand what the nurse role can bring, or advisor role, then it's a bit of a waste of skill, if you like. So I mean, there are nursing roles that are there to respond to emergencies. That's what they are there for. And then there's other roles that have more specific, looking at a business point of view. So I'm just trying to say, I guess, that, understand what the qualifications of the health professional that you have on your site and what they can bring, and don't just tar all nurses with the same brush, I mean, this isn't our own nurses in hospitals don't know necessarily what occupational health is. So we've got a lot of work to do to help businesses understand where occupational health actually plays a role, and that, bring us out of the corner and let us have a say, because we can actually help businesses quite substantially, if you like. If it's not, doesn't need to be seen as a luxury. If you see it as more of that proactive prevention, and not just from a mental health point of view, but from a physical point of view as well. Preventing injuries is what we really want to do, not patch them up. And that's why we moved into occupational health, because it is about promotion at all levels, not just yes, we can patch people up. We can, and we're very good at rehabilitation as well. But that's what makes us unique from the health and safety role, for example, because we do have that knowledge. We've got that prevention knowledge, but we also have a good understanding. And when you're talking about the mental illness space, we also have a good understanding of what we need to do to support that person back into the workplace, and understand medications and all of those sort of things to support that.